All right, welcome. We are very glad that you are here. Thank you so much for joining us for this early childhood workshop. We're going to be focusing on personal protective equipment, or PPE, specifically masking in early childhood environments. We have a panel of wonderful experts from the early childhood field and the health field that we're excited to share some of their insights and their expertise with you, and hopefully some practical strategies that you could use in a classroom or in your work with children and families. So we're very excited for tonight. Kelly, do you want to go to the next slide? My name is Dr. Eric Boucher. I'm the Executive Director of the Arizona Association for the Education of Young Children, which is one of our two state affiliates of NAEYC, the National Association for the Education of Young Children. Kelly, you are just breezing by.
Sorry.
Lots of content today, no worries. Please stay connected with us. We share lots of information about early childhood content, advocacy, and public policy on behalf of children, families, and educators. So follow me on Twitter and Facebook, and we share our information as it becomes available. Next slide. This is certainly a collaborative effort, and I just wanted to take a moment to thank a few of our partners and let them introduce themselves to you so you can put a name with a face. I do want to mention that this event is part of a series of childcare COVID-19 sessions that we've been offering across the community for childcare providers and early learning professionals to come together and just talk about some of the challenges they've been facing with COVID-19 and really come up with some plans and some ideas for practical strategies that they can use based on the new research and health information that we have available to us. So part of that partnership is between 4 agencies, AEYC, which is the organization that I work with, Arizona Early Childhood Education Association, Child and Family Resources, which helps facilitate the Child Care Resource and Referral Network, and the Southern Arizona Association for the Education of Young Children. So I'd like to take a moment to have Barbie and Kelly introduce themselves. Whoever wants to go first can go first.
Go for it, Kelly. Hi, everyone. I'm Kelly Larkin. I'm with the Southern Arizona Association for the Education of Young Children. Thank you for joining us tonight.
Thanks, Kelly.
Hi, I'm Barbie Prinster with the Arizona Early Childhood Education Association. And yes, thank you so much for joining us tonight.
And our good colleague and friend, Michelle St. Hilaire, works with Child and Family Resources. She's not able to join us tonight, but she's definitely here in spirit and in heart. So we just wanted to call out that partnership of 4 agencies really trying to provide some forums for childcare providers across the state to come together has been something we've been working on since the pandemic began. We also wanted to highlight 2 special colleagues that are organizations that are joining us tonight. Our colleagues from the Arizona the AZ Child Life Network and First Things First colleagues, as well as technical assistance providers, are here as well. So I just want to take a moment to have Courtney and Sarah introduce themselves, and then we'll save our special health expert guests and we'll introduce them in just a few slides.
Hi, everybody. I'm Courtney King. I'm one of the Quality First Program coordinators at First Things First, and we're happy to join you tonight.
Good evening, everyone. I'm Sarah Harrison. I am a program specialist for children's health at First Things First, and I oversee this child care health consultation strategy for the state, and we're really excited to have you with us tonight.
Great, we're glad you're here. So again, I just wanted to highlight how important collaborations between state and local agencies are in addressing COVID-19 for childcare. And so our goal tonight is really to use the expertise of all of the people on this panel to help provide some information and some ideas and some resources so that you can make decisions in your local community, in your local context that are best for your children and your families. I also do want to mention that this workshop is provided at no cost to you, thanks to funding from the Robert Wood Johnson Foundation in partnership with Child Care Aware of America and NAEYC. Next slide, please. We know that early childhood education is essential, and the work that we do in the community is really some of the most important work because it builds the brains of our youngest learners. And so we just want to take a moment to thank you for your public service and your support of young children and families. And so before we move on, I do want to take a poll. So I'm going to press a button, and it's going to ask you to fill out a quick poll just to tell us what you do in the field, and then you can kind of see who the other people on the line are as well. So Give me just a moment here. I'm gonna launch the polling and it should pop up on your screen. And it should allow you to click, tell us just what you do in the community. Are you an educator for infants and toddlers? Are you an educator for preschoolers, for K through 8? Are you an administrator, coach, TA provider, state agency rep, or maybe someone else? We'll give you a couple moments to fill out that poll. All right, last votes are coming in. We are excited to have nearly 200 people from across the state, and it looks like even other states, joining us today to hear a little bit more about masking with young children and some of the ways in which we can take healthcare information and research and make it practical in an early learning setting with young children. We have about 25% infant and toddler educators, about 36% preschool educators, 4% K-8 educators, and about 24% directors and administrators, and then about 4% coaches, technical assistance providers, state agency representatives. So welcome all of you. We are glad that you're here. Tonight's session really is focused on, I can share the results, I think. This session tonight is really focused on specifically people who work directly with children, whether you're with young children who are infants, toddlers, or preschoolers, or maybe K through 3 setting. Our goal is to really provide some practical information specifically around that age. So thank you for indulging in our poll there. All right, next slide, please. All right, so here's our agenda, just to kind of set the stage for what we're hoping to talk through today. We're doing our welcome and introductions right now. We're going to spend most of our time with a panel discussion with health and early childhood experts, talking about what is personal protective equipment, why is it important, some considerations for wearing cloth masks, both for adults and for children over the age of 2, and then some strategies for supporting, practical strategies for supporting children in effectively wearing their masks and engaging in masking as part of their everyday routine. We're probably going to take a break somewhere in there just for a few minutes to kind of reset and give you a moment to digest all of the important information that we're going to share tonight. And then we want to spend the rest of the evening providing an opportunity for us to just kind of talk and share some of our ideas and challenges, or maybe some successes you've had as a provider exploring masking with children. So if you are someone who works with children and you've been doing masking and having kids or staff wear masks in your program, we would love to hear any of the successes that have happened in your program later this evening. So just kind of think about what successes you might share, any advice that you might share to other people who are going to try masking with their students. And we'll have an opportunity for you to share for about 2 or 3 minutes your story and some of the successes you've been facing. So just to kind of take a moment to think about that. And then we'll wrap up with some questions and answers. So you'll have a chance to have your specific questions answered by our group of expert panelists. And then we want to share a couple resources that we hope will help you make some decisions at the local level for your program. Excuse me, next slide, please. Really one of our main goals tonight is it's not to provide you with specific here's what you should do. It's really to provide you with some ideas and resources and research to make some more informed decisions at your local level. So the intent of tonight is not to give you recommendations or guidance. We really encourage you to follow the Centers for Disease Control and Prevention and the World Health Organization guidance at the national level, and then also the Arizona Department of Health Services guidance and recommendations at the state level. Those are the most important resources to be following and making decisions with. But we also just want to be very clear that tonight we want to share some ideas and some practical strategies that you may test out with children, but they're by no means any specific, like you have to or you're required to do this. It's just some information to help you make some data-driven decisions that'll support your children and families. Next slide, please. So without further ado, I wanted to make sure we set the context. And now we're just so excited to share some insight from people who have been doing this work with children and with families in the community who have health expertise and early childhood expertise. So I would love for each person to just take a moment to introduce yourself and tell us who you are and what you do. And then we'll move into sharing some of their insight and strategies and expertise with all of you as attendees. Karen, do you want to start us off? Karen, you'll have to unmute. I do that all the time.
Good evening. My name is Karen Hoffman, and I am a registered nurse. I work at Maricopa County Department of Public Health, and I work with Quality First, First Things First. I'm a child care health consultant supervisor, and I've been doing that for approximately, well, since the program began about 10 to 11 years ago. I've been in nursing for about 30 years.
Great, thank you. Wendy?
Hi, I'm Wendy Pauker, and I'm the Senior Manager of the Child Life and Hospital School Program at Banner Thunderbird. And I have been in Child Life for about 29 years. Prior to Banner, I was at Phoenix Children's Hospital for 16 years. And we are just happy to be here tonight, so thank you.
Great, thanks. Jody?
Hi guys, my name is Jody Rawl. I'm the hospital school teacher at Banner Thunderbird Medical Center, and I've been in the healthcare field probably about 17 years. I was at Phoenix Children's, so that's where I met Wendy, and I have been at Banner Thunderbird about 10 years. And my job is to be the liaison between our chronically ill population and school.
Great, thank you, Jody. Stephanie?
You bet.
Hey, I'm Stephanie. I am a child life intern, so the step right before becoming certified. And I have been in the hospital in some capacity for the last 5 years.
Great, thank you. And Dr. Tavasoli?
Hi, my name is Kyoko Tavasori. I'm a regional supervisor for Smart Support Program at the Southwest Human Development. We provide early childhood mental health consultation for child care centers and preschool, and I'm so happy to be here with all of you. Thank you.
Great, welcome. So I know we can't hear you, but if you just want to join us in welcoming our distinguished panel of health and early childhood experts here to share their expertise and their insight. We've been hearing from providers for months and months that they understand the health information that's coming out. They've been staying up to date on the research and the information from local health departments, from the state health department, from across the nation, but they really want to know how they can take that information and make it work with young children in early learning programs, in preschools, in school district settings. And so our goal tonight is really to go through and give you a little bit of an overview about just what is personal protective equipment, and what is masking and why is it important. And then we're going to go into some specific strategies that you may be able to use in the work that you do with children. So our goal is to be responsive to your questions and your ideas. So please keep them coming in the chat box there at the bottom. And thank you to Sarah and our other panelists who've been helping to answer those throughout tonight. I'm going to turn it over to Karen, and we're going to move into the next slide and talk a little bit more about PPE.
The poll is still up on my screen. Is it up on everybody's?
You should be able to just X out of it, Karen.
Oh, okay. I didn't know if I had to do that or, okay, I'm good. Okay, good evening, everybody. I'm here tonight to talk about what PPE stands for. We've heard this quite a bit since COVID's come into our lives. And I know a lot of you probably already know it, but it stands for personal protective equipment. And it's a specialized type of clothing or equipment that's worn for protection against infectious materials. One thing I want to note is we're going to be talking a lot about cloth masks or face coverings tonight. And we want to make a distinguish between the face mask and the respirator masks, which are the N95s. Respirator masks are considered PPE, while cloth masks and surgical masks are considered medical devices. So to go into what kind of PPE is available, we have gloves that are to protect our hands, and we use those when we're handling chemicals or blood or bodily fluids. And if we have like a cut on our finger, we would wear gloves, and also when diapering. Then there's goggles that we use to protect our eyes, and that can be used for when you're going to mix bleach in your facility, for instance, or any kind of cleaning solutions. Face coverings, which we're going to talk about a lot tonight. That's what the CDC is currently recommending for all childcare, for staff to be worn. And we'll go into that in more detail in another slide. And then there's gowns. And the gowns are used to cover your body and your clothing and keep it protected from any kind of COVID germs out there. And we recommend that for, depending on what kind of welcome arrival health check you're doing at your center. There's 3 different types in the CDC recommendations. And in one of them, you would have to wear a gown if you're going to be coming in close contact with people. But you'll have to look that up and decide which method you're going to use. You could also use a gown in the infant room to cover your clothing and protect the infant from your clothing that might have any kind of infectious infection on your clothing, or a smock or something like that. And then, of course, the combination of PPEs, when you're doing the screening method, you could wear all different things together. Next slide, please. So in this slide, we're going to watch a video with Bill Nye, the science guy, and he's asking the question, why do people in the scientific community want you to wear a face mask? No sound.
All right, hold on. Thank you for being with us. It's a short video, but I think it explains really well why masks are particularly important. So let me try one more thing out. That's the excitement of using technology.
Greetings, everyone. Bill Nye here. Why do people in the scientific community want you to wear a face mask when you're out in public? Well, please consider the following. Face masks, like this one, prevent particles from my respiratory system from getting into the air and then into your respiratory system. Blocking the movement of air is an old trick. Here's a scarf. It blocks the movement of air around my throat. Helps keep me warm. This scarf won awards in the Washington State Fair for both design and workmanship. It can block the movement of air, but only to a certain extent. This is a homemade face mask. It has just 2 layers of cloth with a pipe cleaner sewn in to help it fit against the bridge of your nose. And it blocks the movement of air very effectively. If you're wearing one of these, you're protecting yourself and those around you. Greetings, everyone. Bill Nye here. Why do people in the scientific...
All right, Kelly, I'll turn it back over to you to share the PowerPoint again.
Thanks for being patient. There it is.
Okay, so I thought that video with Bill Nye was pretty self-explanatory and does point out how face masks can work really well for us. Considerations that we want to look at for wearing cloth face coverings. Cloth face coverings are recommended as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people when the person wearing the cloth face covering coughs, sneezes, talks, or raises their voice. Studies have been done to show that a cloth face covering can protect you from putting out droplets if you're talking, if you're coughing, and it protects others around you. COVID spreads when in close contact, which is less than 6 feet. So if you're less than 6 feet from someone, COVID can be spread. That's why we say social distancing is really important, because that's 6 feet or more. So when you wear a face mask, it is important that you need to wear a face mask when you cannot social distance. If you are social distancing, sometimes you can remove the face mask because you are far enough away that you won't be getting any droplets from someone else. The other thing we want to talk about here is face shields. People bring up face shields a lot. And face shields are that clear mask that you see. You've seen the health providers wear them in the hospitals. They wear a face mask and then they put the face shield over it to protect their eyes. And some people want to know, can we just wear the face shield? And it's not recommended by the CDC as guidance to wear just a face shield because it's not going to work as well. They really want you to wear a face covering with the face shield. However, some people are unable to wear face shields. And so if that's, I mean, not face shields, face masks. And so if they are unable to wear the face mask, then maybe the face shield is better than nothing. However, again, you have to remember that the CDC is not recommending wearing that alone. And then also I want to say about a face shield, if you do wear them and they're disposable, you must throw them away. And if they're reusable, after wearing them, you must clean and disinfect them. Next slide. So why are face coverings so important? Well, we kind of talked about that already because it's really protecting other people around you from your droplets. So as you can see in that top picture of the person without the face mask, there's one on the left without the face mask, and on the right, a person has a face mask. But if a person didn't have a face mask, that would be maximum exposure because you'd be both talking and spreading droplets. Whereas if two people are wearing face masks, in the bottom picture, see how there are less droplets that come out because they have face masks on, and they're both protecting each other. Now there is some studies out there have kind of pointed to the fact that you are being protected yourself by wearing it, but I think more it points to the fact that you are protecting the people around you. That's why everybody should be wearing a face mask. Now the CDC recommends that wearing cloth coverings may not be possible in every situation, and for some people it's not good at all because of health situations they're in, like they might have physical, mental health condition, and it could lead to a medical emergency. And so that's when you have to think of alternatives for people like that. And those people should really not come in close contact with people if they can help it, because they're going to be more vulnerable. Next slide. Okay, so who should not wear a cloth face covering? It should not be worn by children under 2. And anyone with trouble breathing, like with asthma or any kind of breathing condition. Anyone who is unconscious, of course, and incapacitated or unstable to remove the cloth face covering without assistance. What we are recommending through the CDC is that staff and 6 years old and up in a childcare facility should be wearing masks. Now there's the 3 to 5 year old, which is a gray area of whether they should wear them or not. And that's really a case by case basis because they want the child to be able to wear the mask without touching it, without fooling around with it all day. They need to be able to take it off by themselves, put it on by themselves. And so if a child cannot do that from 3 to 5, in Maricopa County, they will not cite a child 3 to 5 who is not wearing a face mask in a childcare facility. However, because all of our cities and counties made ordinances about face masks, you have to look at each separate one to figure out what yours should be. If you have a city that made some regulations about it, you follow that. If your city didn't make regulations, you follow your county. And and if you're from a different state, which I saw some people were, you're gonna have to look at your state regulations or your county regulations as well. Next slide. Okay, safety considerations for children. A child should not be wearing a mask during nap or rest time. It's a suffocation hazard. It is not a suggested practice if the child cannot put on or take off face coverings by themselves and or causes the child to touch their face more often. Because one of the rules with COVID is we don't want to be touching our face a lot. So if they're touching their face more because they have a face mask on, this is not good either. We want to be able to store the face coverings in individual containers when not in use. Example, a plastic container in a child's cubby. Now, the question has come up about the fact that then it would be available to any child to go into it. So maybe you want to find a place where children can't have access to the container, but they should be labeled with the child's name. And you can also use a Ziploc bag if it's not going to be for very long, or you can use a paper bag if it's going to be long storage, but always label. And you want to ensure that children maintain adequate hydration when they're wearing masks because they'll have a tendency not to drink as much because your face is covered. Next slide. So how do we wear face coverings? Well, the pictures on this page kind of point to that. The top 3 people have green check marks, and that means they're wearing their face masks appropriately. I can't speak. And the 3 people on the bottom are not being appropriate with their face masks. So you always want to wash your hands before putting on your face covering. And I'm going to demonstrate that in a minute. And then you're going to put it over your nose and mouth and secure it under your chin. You're going to try it to fit snugly against the sides of your face, because I've seen some homemade ones that are really big and they kind of puff out at the side, and that's not really good. And then you want to make sure you can breathe easily. I'm going to demonstrate. I have a mask here. And so I would get some hand sanitizer and wash my hands first. I would pick up the mask by the loops and I would put it over my face and put it around my ears. And then I would pinch the nose, make sure it's over the nose. Oh, this is not working very good. I'm nervous, I guess. And then I would pull the face mask down under the chin. This one was homemade. It fits pretty good. It's nice and snug against my face. If you do touch the outside of the face mask, you want to make sure you wash your hands, because there could be germs on the outside of the face mask. So then to remove it, you would wash your hands again. And I know we all see Governor Ducey do this when he's on TV. And then you take the loops to remove it. You would fold it in like this, because that's going to be the germs that aren't your germs. Your germs are on the inside. Yes, there are germs there. You can't be always 100% good with germs, but you want to fold it in and then store it in a bag with this fold this way. And again, be careful when you take it out of the bag. Don't touch the outside. You can go to the next slide, because it's going to demonstrate in this diagram also the same thing I just said. So how do you remove a face covering? You always want to store or reuse or discard following manufacturer's instructions with face masks. So in number 1, what I just did and showed you was handle the cover only by the ear loops. Stretch the ear loops to remove your cover. So she's taking off her face mask right now, and that's what I just showed you a bit ago. In number 2, you fold the outside corners together so that the front of the mask is together. And you want to try to avoid touching the outside, because there's germs that you don't want to touch there. And then you want to carefully put it into a Ziploc bag or a plastic container or airtight container, and then wash your hands after touching the face cover. It's really important to combine the hand washing with the storing of the face mask and not touching the outside. We want to do all those things to kind of protect ourselves. And then you always store, you want to store away so that they don't get wet, dirty, or damaged. So that's why we want to put them in a place where they're not going to get damaged or dirty. And then you can wash it regular laundry with soap and as warm as possible. Sometimes you wouldn't want to use too hot of water, because it will shrink the homemade mask. So just beware of what fabric it's made out of. Use in the dryer to dry, or you can dry flat and let it dry, but it has to be completely dry before you use it again. Store, like I said, in paper bags for long-term storage, and Ziploc or airtight container otherwise. Next slide. Oh, I guess we're done.
All right, thanks, Karen. Before we move on to the next section, we had 2 questions specifically about masks with young children that I think we could answer now. Courtney, there is one I think that you might have a response to, and then Sarah, one you might have a response to.
I'm sorry, Eric, will you read me the question?
I believe there was a question that said around developmentally appropriate interactions with children, and that when children or staff are wearing masks, you can't see their
Right.
mouths. So sort of what
yes, that is absolutely true. And I'm sure Kyoko might be able to chime in when she does her part as well. When young children, we talk a lot about emotional expression and children reading your face and that being important. But when you wear a mask and the lower half is covered, you need to remember that a lot of your body is still open to children. Your gestures and your movement, your eye contact. Think about when you're standing across the room from your very best friend and you can see the joy of seeing somebody, or you're standing way far away and you can see someone's anger. There's more to your body than just what's right up front. And so you may need to emphasize some of your other body parts, but it's there for children to see those minute facial expressions as your eyes crinkle, as your forehead crinkles. They'll just focus on other parts of your body. And I'm sure we'll talk a little bit later about some more of that too.
Great, thank you. And then Karen, there's another question specifically about the type of mask. Is there a information about whether a cloth mask or a disposable mask is more effective, and sort of what might people be looking for in a particular type of like make of a mask?
I think either of those are fine to wear, the cloth or the paper. You just have to dispose of the paper when you're done with it. The cloth, you have to make sure you wash. We're trying to reserve, I meant to say this in the presentation, we're trying to reserve the N95 respirator masks for healthcare providers. So we wouldn't really recommend that you go out and buy those because it's really not that necessary. I think a cloth or a paper mask will do the job, and then that's what the evidence shows.
Great, thank you. So now we're going to turn it over to Jody and Wendy and Stephanie, who are going to talk a little bit more about the work they've been doing in hospitals, masking with children even before the pandemic, and some great ideas they have that you might be able to try out with children as well. So ladies, take it away.
The kids, what we ended up doing was ordering cloth masks on Amazon, and it came in a 50-pack of these white soft cotton masks, and we ordered fabric markers that came with stencils for the kids to decorate their own masks. And this has been so popular with the kids. I mean, they really, really take pride in making the mask, showing it off. The kids also have really been into making a mask for their nurse or for their family members. And the great things about these masks is that they can be washed over and over. So, you know, in a classroom setting, you know, the kids get to design their own mask, they get to show their mask off. And at the end of the day, you kind of give them the responsibility also of taking their mask home every day and washing it really good with soap and water and just hang it to dry to bring back for the next day at school. And so this has really been a very popular thing with the kids. And the picture that you see is a picture of Jody working with one of our patients, making her own mask. So that's one of the things that we have found to be super helpful with the kids in getting them to wear their mask. The other thing too is that, you know, even prior to all this, any of the kids that are diagnosed with any sort of a chronic illness in the hospital, really once they leave the hospital, and because their immune system is compromised, they have to wear a mask. And the mask that they usually wear is a VOG mask that has like a respirator thing on the front. It even fits a little bit snugger. And I think, you know, we've had the parents say to us how surprising the kids just do it. They don't have a choice, and they have just kind of learned that with their illness or with their sickness, or while they're under any sort of treatment that would compromise their immune system, you just wear a mask. And I think that we have just found that whether they're 3 or 5 or 12 or 15, the kids wear the mask. So we're hoping that when the kids go back to school, that it's going to be a little bit easier than everybody's anticipating. But, you know, I was thinking for some of the schools that may have had masks donated, let's say you had an overabundance of masks donated, just to have a fun activity or something to do with the kids, maybe let them on a piece of paper design their own mask. If they could design their own mask, what would they want their mask to look like? And share that with the class. So giving them ownership, letting them be proud and part of these decisions, I think will be very helpful in the classrooms. So Jody, I'll let you maybe take it from here.
Okie doke. Well, as you can see in that last picture, we were creating our patient, that was one of our 8-year-old patients, and her own mask, and she was so excited about it. And like Wendy was saying, we have Wendy bought these masks from Amazon at a great price. I'm not sure how the schools are going to be funded as far as masking or if those are going to be provided. But I think to make each mask their own is very important. I think that our kiddos have a sense of ownership and are more excited when it's something that they've created on their own. I think that you as educators modeling, like, I don't know, maybe the first week or two, modeling how you put a mask on and off correctly so you can show what to do and what not to do. And kids are so visual. I think it's such an important thing for you as the educator to model proper use of masks. I think also that I know that I was looking at some videos and there's some really great fun videos about superheroes. And I know most kids, even adults like me, identify with a lot of superheroes. So I was saying in the last presentation that we have a great connection with some superheroes that would be more than willing to come to your schools and do a fun presentation to get our kids excited about something like this. And also, I think with the social distancing thing, that if you could somehow set up a 6-foot area that our kiddos can actually visualize and see, because some of our kids, they don't know what the heck 6 feet the distance is. So I think it'd be great to actually have a visual that our kiddos could follow. And I think the more fun, the better. I think even if you could have like a teddy bear or a doll or something along those lines that our kiddos could practice on, that they would feel a easier sense of getting used to the mask and being more apt to wearing it. That's all I have.
Just so you guys know, the masks that we purchased for the hospital, I think I said they were 50 masks, 50, for like $24 or $25. So it was very reasonable to do that. One of the other things too that we talked about in the last session was including the kids too in the cleaning process, maybe in the classroom. If you guys decide in the middle of the day that you're going to disinfect or wipe down the desks, get the kids involved in helping with that. Turn on some fun music and make it fun for the kids to help with some of those responsibilities in the classroom to keep it a safe environment.
I think that's great. I truly think any time you can bring music into something with our early childhood kiddos, it makes it fun. I think the more fun, but the better. But they also need to understand the reasons behind mask wearing, because some homes might be different. Some families might share their views on mask wearing. It might not connect with what the school that they're attending is. So I think the more education, the better. And just to make it honest, but not, a horrible thing, but just make it honest and open and have it be a question and answer for our kiddos, because they're eager. They want to understand what's going on. And I think that being present is best. I also think if you're doing like Zoom things, I'm not sure if how our early childhood and our early like K through 12, whatever's going to be going on with that. But I think Zoom, however we can connect with Zoom as well, do like mask decorating that way as well. I'm not sure how every school is going to be set up, but I think interactive with their peers is huge.
So real quick, I just wanted to say that our Child Life, our job in the hospital is to teach kids about any procedures that they're going to have, and then also explain any diagnosis to them. So like Jody was saying, I think it's super important to be honest with them about what's going on and why they have to wear the mask. Kids have definitely heard COVID-19 or coronavirus, so you want to make sure that you call it that. So when when there's a new diagnosis in the hospital, we will always tell the kids, like, you have cancer, you were diagnosed with Crohn's, or make sure to be completely honest with them. So it's important to let them know that the reason that they're wearing the mask is because of coronavirus or COVID-19. Next slide. And then you want to make sure that you're using developmentally appropriate language. So when you're explaining what coronavirus is to them, just make sure that you're using words that they understand. And then letting them know that, so in the hospital, when we give a kid or let a kid know that they have a new diagnosis, or if we're going to go over a procedure with them and help them with that, we give them jobs. We make sure that they know if they're going to get an IV, that they have to stay really, really still. And then that's their job, and to take big, deep breaths. So you want to give kids jobs. You want to make sure to tell them to wash their hands. Their job is to wash their hands and keep their hands clean, and to wear their masks so they don't get their friends sick or spread germs. And then also, it's good for them to be able to see the mask. I know, like, sometimes when I'm leaving to go into the grocery store and I leave my car and then I see somebody with a mask, it's a visual reminder, hey, I need to have my mask on. I need to not touch my face. So it also provides that for kids too. When they see their friends wearing their mask, they know, oh, I got to keep my mask on right now. I need to stay that 6 feet and I need to not touch my face. So it's that visual reminder. Next slide, please. And then, like Wendy was saying, letting them decorate their mask gives them that autonomy. It makes that mask theirs. They're proud of it. And it's not just something that we're giving to them and we're like, put this on your face, it's important. They now have ownership of it, and it's special to them. And then in the hospital, for kids to get used to different things in the hospital, we desensitize it and we normalize it by letting them play with it. Children's language is play. So we will give them a mask and they will put it on their teddy and they'll put it on their doll, and that's a good way for them to practice putting it on. But it also isn't this scary item. They've manipulated it, they've played with it, so they're not as afraid to put it on their face now that they've had a chance to use it. And then also seeing their parent, if you can get the parents to practice at home before they're going to school and trying to wear it for long periods of time. I have a 4-year-old, so we did like a sticker chart to incentivize her to wear it more. And if she was able to get to wearing her mask without touching it for 3 hours, then we would do like stickers. We'd increase it 30 minutes and then she would get a popsicle. So just trying to make it fun. And then I would also wear my mask at the same time, so she could see that I was doing it with her, and then also that it could be done. And then during that 3 hours that she was able to wear it, I was distracting her, which is something we do in the hospital too. Some kids don't want to see a poke going in, so we'll distract them with an iPad or games or I Spy, something like that. So keeping them distracted as they're getting used to their mask is also super helpful. That's it.
Okay, so next I'm gonna talk about a little bit about social emotional development and face mask. And Jody and Wendy, Stephanie talked wonderful stuff about how to help children wear masks. But here, my part, I'd like to emphasize how to help children's social emotional development when adults are wearing face masks. Like we had some great question earlier, and Connie provided wonderful information and suggestion. So face masks really hide a big part of facial expression covered until this much. So what that mean to children's social emotional development? So because the face mask is hide facial expression, that is a very important part of emotional cue. So as you see in those 3 circles, emotional cue consists of tone of voice and also body posture and facial expression. And of course, facial expression is not the only emotional cue, but it's important and big part of emotional cue. And if that is a partially hidden, what could be the impact on social emotional development of children that we may need to consider? For example, attunement and responsible caregiving. When face is covered partially, how we can attune the children's emotion and respond to it, and or a sense of safety. The familiar face of teachers are covered, a big part of their face. How we can still promote the sense of safety for children, especially for children with a traumatic experience. And also emotional literacy and emotional regulation. It's helping children to identify and label their emotion is a big part of their skills. And again, when the face is partially covered, how we can support those areas. And again, those goes to the friendship skills, expressing your emotion and also picking an emotional cue from friend. That's very important interaction skills, and that could be impacted by face mask. And also cultural responsiveness that we may want to consider, like covering face may have a different meaning to different community or different cultural groups. And also this overall, the COVID-19, some bias against particular culture. So we need to take into consideration all those aspects for social, emotional being of social, young children. And also another domain is of development, like speech and language development. So younger children really learn watching around the mouth for their speech language development, how that could impact it. And those aspects we would like to take consideration when thinking about social emotional development and face masking of caregiver. Please, next slide. But we still, like Connie mentioned, we still can be very creative and supplement what we still can do to promote social emotional development and sending emotional cues and communicating with children through emotional cues. And here's a couple strategy that I listed. Like for example, still eyebrow, eye, body movement, gesture, those are important way to communicate emotions. We can provide, a teacher may be able to facilitate some activity with children, practice emotional expression with masks, like guessing games, using mirror. Those could be great strategies. And also we can use visual cues for emotional cue as well. Like maybe teacher can put the teacher may be able to put different emotional expression, facial expression, and then when she try to show certain type of emotion, she can put the picture by the face and then talking about the emotion. Could be sign language, could be more incorporated. And also a scripted story of social situation, puppet show, song to talk about emotions. And also promoting pretend to play with stuffed animals or dolls to help children make sense what this change of their routine mean. Our familiar teacher, our loving teacher wearing mask, but still we can trust them. They're still caring for us. That's very important for us to communicate with children. Will you, I'm sorry, I got a phone call. So, and also please, next slide. Okay. So, as just a reminder, this is COVID-19 crisis. Each person's situation may be different, but we are in the same storm. we really need to keep in mind that we really want to help children, but we really want to support teachers. We try to protect physical safety for everybody by promoting face covering, but at the same time, we really need to care for their emotional well-being as well, because this is COVID-19 impacted many people involved in a child care or preschool in the community, and some children may have a more difficult time to get used to, or teacher wearing face mask may give them more anxiety. And teacher wearing mask, depending on the law or of the community or center, how long their mask, and that could be physically and emotionally draining. And also the caregiver as teacher, they are in a difficult situation. Their loved one may be impacted by this COVID-19 emotionally or financially or many different ways. So I think it's when we talk about introducing face mask to child care center, we really want to see this situation and address from trauma-informed perspective, and how we can bring a compassionate trauma-informed care and an approach, not only for children and family, but also teacher and director. And our program funded by First Things First can come to your center and create a individualized support to work with your teacher and director, and please contact us if you're interested in. So that's my presentation. Thank you.
Great, thank you so much, Kyoko. I'm wondering, Jody, Stephanie, Wendy, or Karen, do you have any additional information that you want to share before we move into our next section?
I wanted to say that when you're with your kids, like Kyoko was saying, it just, everybody's going through so much right now. And to be understanding and accepting and expressive, it is so important. I think with our early childhood kiddos, I mean, make it fun. I know we can't hug our kids. We can't stand super close to them. But if you could do maybe something fun, like a air high five, or like a, you know, a 6-foot hug or something like that, that lets your kiddos know that you understand, or you still would love to hug. I mean, and even to explain that to them in the beginning, so they understand why teacher won't let me, you know, sit on their lap or something. I think to be able to explain everything to the kiddos, and ask your class as a whole, what do you think would be great for us to do, as far as, you know, to show how great you did, a high five or a hug or whatever it is. But I think to be able to explain to your kiddos that they understand that even though you can't physically give them a hug or have them sit on your lap, that you still feel the need to do something like that. I think we just have to be open with them and have as much fun as we can with them.
On to Jody's point about that, it's so important too, when you're opening the classroom up to their ideas, is COVID-19, this whole 4 or 5 months, whatever, has been so out of control for them. Yeah. They've lost control of so much. So just opening up to their ideas, and they have a ton, just gives them some of that control back in their life where they really need it.
I think too, and I think those are all really great suggestions, but one of my nurses shared with me, because I see there's some concern in people about wearing a face mask all day long. It's a long time to wear a face mask when you're in a child care center, and the kids probably aren't going to be able to do it. So there's times you could take breaks. Like, she had a center that she talked to, and they had a yoga break, and they all went to their carpet tiles, and they took off their masks and they put them in their containers next to them. So they were all social distanced, and they were on their little mats, and they did yoga stretches and breathing, and everybody took a break. And so I think there's things that can be done by taking breaks. I know another director told me that she tells her staff to distance themselves at times from the kids if they can in the room, take the mask off and just breathe for a little bit and just social distance. I think that's perfectly fine. So you just have to consider those things.
The only other thing that I wanted to add in regards to Kyoko talking about facial expressions is that I did want to share that there is a company, a local company here in Phoenix that created masks called See My Smile masks. And it's actually, they're approved and everything. It's some sort of a fabric, and then the middle part where you can see the person's face is a clear plastic. And so I'm just wondering for maybe some of the teachers, it might be an idea to look on the website or to think of some sort of a mask where somehow the kids will be able to see your facial expression or to see your smile. So I just wanted to share that website again. It's See My Smile masks.
Let's hear from our panelists with some of the questions we have in the Q&A box to try to get some clarification. As we mentioned earlier, our goal here is just to give you some resources or information that could be helpful for you to make some decisions at your local level. I do want to just point out we certainly don't have all the answers. I think we're all trying to figure this out together based on the information and research that we have. So please know that we're going to try to share, the insight that we have. But if there's other information that we don't know the answer to, we'll try to point you, to the right direction to be able to get that information. So actually, why don't we do this before we do Q&A? Why don't I share these next few slides? Kelly, would you click through the words? Then we'll do our Q&A. So let's talk through what it looks like to support early childhood staff. So your colleagues, if you're an administrator, what it looks like to support the early childhood professionals that you work with. It's particularly important if you're moving towards masking, universal masking with your students and with your staff, to really help the adults understand, the parents, the staff and the parents, understand the reasoning behind why masking would be important for your program. So sharing the research, sharing the content that we've shared tonight, all of those bits of information could be helpful to help people really understand the reasoning behind it so that they're on board in supporting it. Just like any other part of the routine that we do with kids or with staff, wearing a mask takes time and it takes lots and lots of practice. So it's gonna take an investment of energy in teaching people how to do it correctly and then following up and supporting them to do it through a social emotional lens correctly and appropriately. And then our content we've shared today are not recommendations or guidance like a health department would give. They're really just some ideas for you to consider as you're making decisions about the work that you're doing in the community. But we do encourage you to follow the CDC guidance, the Centers for Disease Control and Prevention, as much as possible, and to adjust your policies based on any new information or research that becomes available. Next slide. And now let's do our Q&A. So what I'd like to have happen is I'm going to unmute people who have questions. So I'll just say your name, and then if you want to ask the question that you have aloud, you're welcome to. I also got kicked off on accident, so I can only see the questions that came up the last few moments or so. So if anyone else can see the other questions, you'd be welcome to read those. So why don't we start with some of the older questions. Would someone be willing to just read those aloud, and I can unmute the person who asked it?
Sure. So Melinda, the center I work for has not yet opened, but this is a lot of information that'll be useful. Social distancing is my main concern. How do you keep children from wanting to play with one another as they're used to?
All right, Melinda, I'm going to go ahead and unmute you. Do you have anything else you wanted to say or ask with that question?
No, that was just my main concern. We are going to be getting ready to, I don't know, actually sometime in August maybe, and I work with preschoolers, and we're always group playing, we're always having such a great time, and I'm just like, how do they expect us to keep the kids from playing, away from each other? Social distancing, it's something that they are not used to, we are not used to. So that's just one of my main concerns, like how do we keep them away from one another, 6 feet apart.
Can I answer that? And of course, if anyone else would love
yes.
to speak to. So as we all know, social emotional development is probably one of the most key development areas in a child's earliest life. It teaches them how to become a good friend, how to build relationships with others, and so that's a critical time in their life and a very important area to focus on. In our program, and this is by no means what all programs could do, but in our program, we really looked closely at the guidance from the CDC and the recommendation that if you are unable to social distance, then wearing a mask is particularly important. So our sort of interpretation was our goal is to try to keep as much developmentally appropriate experience as possible, and that's really our main foundational goal. So we did not expect our 3, 4, and 5-year-olds to stay 6 feet apart from each other at all points throughout the day. We did set up some spaces where kids could do some individual work with maybe a teacher nearby or another child nearby to engage in painting or block building or other, as part of the center-based learning anyway, some spaces where kids may be able to do some individual work, but for the most part, they were wearing their masks. They often washed their hands, and so they were able to play closely together, or we supported them to play closely together with the intent that the mask would help reduce some of the, any spread of COVID-19. And that's, again, by no means an answer for all programs. It's just one way that we felt it was important for us to balance both the health and safety research along with what we know about developmentally effective practices. Anyone else on the panel have some other ideas or have heard any other research or information about that?
Well, I've heard some other ideas. We've seen where programs are encouraging, again, the idea that children need to play together, but can you have smaller groups of children play together? So things like in your centers, when you have centers times or interest centers, do you limit the number of children you allow at any one center at a time? So instead of having 10 friends in the block area, do you only allow 5 to give each child a little more room? We've activities, and the idea that in 2, so that there's smaller groups of children in any one place. Again, it's just the idea that there's less contact between germs, even though the children are still closer together. When you increase the other health precautions behind that, like Eric talked about, more hand washing, masks, good cleaning and sanitization practices, every step you take should help reduce the amount of germs that get spread, or hopefully the amount of germs that get spread.
Okay, thanks, Courtney. All right, Melinda, thank you so much for sharing your question. Let's go to our next question. All right, Doa, I've unmuted you. Do you want to go ahead and ask your question?
My question was if a child is crying and like he need like emotional support to comfort him, should I like at this moment, what should I do? What is your recommendation in this? Like, should I still like should I stay away, keeping a social distance, or like to be a role model to other kids, or like just to talk to him, to like comfort him like from distance? So what is your recommendation on this?
Great, thank you for asking. Now let's have our panel go ahead and unmute and answer.
So I think depending on the age group, but some younger children may need physical comfort. And if that's the case, maybe depending on the classroom, considering to incorporate some of the gown, and also like Connie mentioned, hand washing and those things, and frequent hand washing and those things. And then I think that is something to hopefully that will mitigate some physical risk for teachers. And also depending on the situation, maybe having a communication with more family to figure out what is the child's behind, why child is crying. It could be anxiety or discomfort, or child try to get help but cannot express well. There could be many reasons for child crying. So a good start is communicating with parents to figure out what is child's emotional needs would be, and then go from there. Yeah.
Well, that's certainly a tough question. I think a lot of the questions I feel like I've personally been having, and it sounds like many of you may be having as well, is sort of that balance between what we know about developmentally effective practices and really supporting young children's development, and then what we know about what's effective in terms of minimizing the spread of COVID-19 and really following health and safety guidance. And so that's a tough balance to make. And I think while there are lots of ideas and lots of strategies, it's something that I think the program itself would have to reflect on and make some decisions and policies around. I think it, as Kyoko said, it really depends on the child's needs at the time. If we know that infants and toddlers wouldn't be wearing masks because it's just not safe and appropriate for them to wear masks at that age, you have to make some decisions as a program about, I mean, what it looks like to serve an infant or toddler during COVID-19, and how staff protect themselves, as well as how you make sure kids are protected too. So that could be staff wearing masks, that could be wearing a protective covering. I mean, there are lots of, I think, options programs would have to make. Yeah.
Eric, I did have kind of a thought that would maybe be a little bit helpful for the younger kids, the preschool kindergartners, is that maybe the teachers have like very basic faces. Like you have on a piece of paper that's maybe laminated, you have a happy face, maybe then there's another one with a sad face, maybe frustrated, and being able to show the faces to the kids to kind of capture their attention and maybe help them try to understand the feeling that they're having, and they can maybe just point to that picture that would then maybe spark a conversation. Just very, very simple faces for the kids to happy, sad, frustrated, angry. And the teacher can hold that up if she sees that a child is getting frustrated or a child is getting angry. Let the child pick and express themselves by pointing to which feeling that they're having, and just maybe use that as an avenue for expression and conversation.
Great, thank you, Wendy. I did also notice our good colleague and friend Amy Baum is on. Amy, if I unmute you, did you have anything you wanted to share about developmentally appropriate practice? Your program has been open and trying to do some of these policies and procedures. So I'm going to unmute you, or if you want to share if you're doing anything with masking, that would be helpful to hear.
Yeah, hi, I'm happy to share. Thank you so much for doing this. Yeah, we've learned a lot in our month and a half of being open, and I don't know if any of you guys are attending the the Play First Summit right now, but there's some really great stuff they were talking about there. And in terms of listening to the CDC and the great organizations that are out there giving us these recommendations on health and safety, but then at the same token, taking what we know as early childhood professionals about what's best for them in terms of developmentally appropriate practice. And I think it applies to this in terms of especially hugging children and holding them and comforting them. I think in terms of our school, we've decided, yes, we're still hugging, we're still high-fiving. We do wear masks, and we are learning. That's I've learned a lot about even just the procedures you guys are doing there. That's been really helpful. At first, it was just like dirty underwear on the floor everywhere. So we've had to put around protocols as well that are really helpful. But the kids can learn, and they do really well with the masks if you do have protocols and if everybody's wearing them. But that being said, we still need to do what we know is best for children. And so that's what I'm learning right now, and we're still implementing that. And so we just need to take our expertise and implement it on what's really feasible for children at these ages.
Great, thank you so much, Amy. I can read a few more. What are the recommended practices for if a child's sick, and how you might interact with them or support them?
Well, I think what the CDC is recommending, that you have a plan in place in your center and have a place that's is an isolated place where a child can be put if they do end up having symptoms or a fever, and then that child needs to be sent home. And so the question about the change of clothes, is that the one we were talking about? Yes, okay. So that's when I talked about the gowns would come into play there. If you had a sick child in your center that you were waiting to send home and you wanted to protect yourself, a gown might be a good thing, or a smock that's larger than your own clothing to protect yourself from a sick child who might be coughing or sneezing or that type of thing. So yes, those are all good ideas.
Great, thank you. I'm just typing an answer here. What is the protocol for if a staff has tested positive? When is it safe for them to return to school? It sounds like they've heard the virus may become reactive in the body.
So there's different protocols for different situations, and it's according to your public health, local public health, and what they're suggesting. And it also, like our local public health draws upon the CDC guidance. If you test positive for COVID, usually from the onset of symptoms, you stay home for 10 days. And then it was, and 72 hours, so 10 days and 72 hours until you're symptom free of no fever or any other symptoms without taking any kind of over-the-counter medication like to control the fever. But it just changed to 24 hours in the CDC. Now our public health hasn't changed it yet, so I'm waiting to hear. And I couldn't tell you why it changed. I don't know what the rationale is that they went from 3, like it's still 10 days and then 1 day instead of 3 days. But however, if you have someone who tests, who has symptoms and has been exposed to a household member per se, like a child, and the parent has it, they have to be sent home for 14 days in quarantine from the time of their last exposure. So there are all different parameters to look at, and you need to go to your, I don't know where this person's coming from who's asking the question, but they need to go to their public health department to find out what the answer is. And you would want to report it to the public health department as well.
And so if a provider is a licensed provider, it's an infectious disease like any other disease.
Well, no, the ADHS is not saying that. They're saying that because COVID is not listed on the communicable disease list as a reportable disease, that they don't want to be reported to. And so, but that you still have to report it to public health, and you should still post it, of course, and you should notify parents. That is a necessary thing to do, even though it's not on the communicable disease list. So licensing is kind of saying, well, this is what licensing says right now, we're not changing it. But we're saying, yes, do it.
Gotcha, thank you. I want to clarify that piece.
Yeah.
All right, I think we have time for 1 or 2 more questions, then we want to wrap up. Are there any in the chat box that anyone on the panel would feel is important to answer for the good of everyone?
I do see one. Alyssa asked, what is your advice for when a parent requests not to discuss the coronavirus with their child? I think we heard from several people on the panel that it's important to talk to children about the disease and what it means, but what about when you get family requests not to mention that?
So the best practice in the hospital is, I mean, we get pushback like that often sometimes, and really it's just because the parents, they don't know the child development like we do. So we just have to explain and educate them. And sometimes it takes a couple conversations before they come around. But usually education takes care of it. Once they understand why we're being honest and explaining to the children, they usually get on board.
I would also add that some of the statements that were suggested in the PowerPoint and some that Eric shared about we are wearing masks to protect each other and our friends or to stop the spread of germs are just general overall health messaging that may help in that effort too.
Great, thank you. So I hope that your experience with the content and with our panelists was helpful. Like we said, we don't have all the answers, and I think many of us need to, collaborate to figure out those answers. There are lots of things we're still trying to figure out, I think, as communities, as early childhood providers, as a nation. So there's certainly lots of answers. We don't have lots of questions we don't have answers to, but hopefully this content was helpful to give you some insight into the importance of masking with children and staff, and some effective strategies for you to be able to do that if you choose to, in your program with children and families, and of course based on research and what health and safety guidance is. I'd like to go ahead and move us into the next slide so we can start to wrap up. But I do want to let you know that our goal is to continue to offer some additional opportunities where people can come together and talk and start to problem solve and work through some of these challenges and issues that we're all facing as a field. So please be on the lookout in the Arizona Early Childhood Workforce Registry for some additional sessions that will be coming up between now and the fall. So our esteemed panel put together some amazing resources, and there's just about 8 or so that I want to share with you, and then I have a few more things, and then we'll tell you how to get your certificate of professional development. Our colleagues found would you mind going back to the first slide? They found a great realistic book with like real pictures of professionals who wear masks in the community called Let's Talk About Masks. And so I wonder if maybe Stephanie, Wendy, or Jody just wants to real briefly tell us about the book or some ideas you had about the book that maybe preschool teachers could use.
I had actually heard about the book just watching the news, and it was a mom here that had a very young child, and she, just in trying to explain it to her child, she just kind of took it upon herself to write the book. And so I did a little bit of research on it, and it just is a really good book for kids young up until, you know, like late school age. It's just a really appropriate book. And as Eric said, the pictures are pictures of real kids. So it makes it just a really good resource.
Great, thank you. The other 3 resources on this page are health and safety experts, and so they're great places to find everything from the considerations for how to wear a cloth face covering that we talked about earlier today, to how you might do cloth face coverings with children, and then how to protect yourself as a professional from the Maricopa County Department of Public Health. Go to the next slide, please. Some resources here, these are for specifically working with children. Some videos from the number 6 is a video from PBS Kids that you could potentially watch with children. It's a short description of how we get germs to go away by washing our hands. Number 5 is Conscious Discipline, which talks about some ways you can help children to wear masks effectively using really a social emotional lens and a trauma-informed lens. Another video from Sesame Street describes about how we can wear a mask to care for each other during this time. It's a short video that could be helpful for staff or for parents and children. And then the National Center for Pyramid Model Innovations has a great graphic around how you help children understand emotions when they're wearing masks. And there's some strategies for supporting kids to try to, in the meantime, while we're wearing masks, still support their social emotional development. So that's one resource to look at. Next step, please, or next slide, please. There's one more. And then there's a great blog that really helps to identify the factual research-based, science-based information about coronavirus and then dispel any myths or any fiction about the virus. There's one specifically about child care centers that have stayed open during this challenging time and what they've been doing and facing and how they've been surviving or what they need. And so that would be a great one to listen to learn more about kind of what's going on nationally. And then even just subscribing to the coronavirus fact versus fiction from CNN could help provide some really good information to, if parents ask, you know, if they say, oh, but I've heard that you can get carbon dioxide poisoning from breathing in your own carbon dioxide, which is a myth and it's not true, you might have the information from the podcast like that to be able to share with parents. So we wanted to share that. And then I have a few more resources I'd like to share. I do want to tell you where you can get everything that we've talked about today after today. So can you see my screen here? Thumbs up if yes. Okay, perfect. I can only see my screen, so I always want to ask. If you go to azaeyc.org/PPE, all of the resources that we just mentioned are on this website, along with the agendas, which have the presenter information in case you want to connect with them, as well as some additional downloadable handouts and other links that could be helpful for both supporting children as well as supporting the business side of childcare. I did also want to mention that AZ Toolkit is our statewide early childhood subscription website that has pretty much anything you could want for running a childcare business during COVID-19 and beyond is all in one place, accessible in AZ Toolkit. So everything from updated health and safety policies and procedures, templates that you can edit based on your own need that have been vetted by national lawyers, instant buying power to access gloves, cleaning supplies, office supplies, and other childcare products, curriculum materials or family engagement tools. And there's an entire section about coronavirus resources for how to talk with staff about it, how to talk with parents about it, posters you can hang up to remind people how to wash their hands or how to social distance. So it's an all-inclusive, all-in-one resource for childcare providers, sponsored by AZYC. So we just wanted to share that as a resource to access some additional information. And then of course, stay connected with us on social media to hear more about some upcoming events or sessions and to learn more about how we can get some additional funding for childcare. At the federal level, the Senate has introduced it, but hasn't gotten much farther than that. So if you are a program that is struggling and really needs additional funding from the federal government to access things like gloves or hand sanitizer or masks for children, we need that money as a state, and so our federal government needs to support us to get that funding. So I would recommend that you call, or I encourage you to call on your own time, Senators McSally and Sinema and ask them to be a co-sponsor of the Child Care is Essential Act. That would provide $50 billion nationwide for childcare providers to be able to access things like PPE, to be able to pay teachers and keep them on the payroll, to provide health benefits, cover fixed costs, those kinds of things. So contact our senators and ask them to support Child Care is Essential Act. Will you join me, everyone, just thanking our amazing panel of health and early childhood experts for their support and their time today, sharing some of their insight and their expertise. So thank you to our panel. We greatly appreciate your time and your energy in supporting this session. Thank you. And also, please take just a few minutes of your time when you log off tonight to go to bit.ly/PPE and ECE to complete a brief 1 to 2 minute survey about your experience. And then you'll actually put your registry ID number in the survey, and that tells me that you participated, so I can mark you as completed in the Early Childhood Workforce Registry. If you're not in the Early Childhood Workforce Registry, or you just would prefer like a printed copy, just shoot me an email, and you should be able to respond to the email that I sent you with the agenda. Just shoot me an email and say I would like a printed copy, and I'll send you a PDF version of that. So once you complete that survey, in about 5 to 7 business days, I will mark you as attended in the registry. We would wish you well. We hope you stay connected with us so that you can see some upcoming sessions. Have a good rest of your night, and we'll stay in touch with some additional resources shortly.